when breathing gets difficult, that's when we realize the importance of breathing. Mouths are not meant to breathe. The whole body's mechanism is designed in a way where we breathe through our nose.
Yeah.
Okay. So first thing is nasal breathing. So people ask me, is nasal breathing important? I say it's not important. It's how it should be. So ideally, a breathing pattern would look something like nasal, light, without noise, inaudible, slow, deep. This should be the graph. Slow and subtle, without having lot of jerks in between.
So today we have a guest who practices a profession which is very unique in its own nature. We have Hilor Desai, who's a breathing specialist, breathing trainer, and hi Hilor, thank you for coming.
Hi, how are you?
All good. So how did you get with breathing as a pattern? Breathing as a technique that you want to pursue.
Yeah, so basically, I have been an athlete. So, breathing is a very essential part of an athlete's journey.
Yeah, true.
So, I used to inculcate various form of techniques and everything in order to improve my endurance, recovery, everything. That's how I came across it, and then I realized the importance and the impact that it has, and the way it changed my athletic abilities and the other aspects of life too. So I was like, I should tap into this, and the more I tapped into this, the more I realized this is just not for athletes, because
True.
everyone breathes, and this has a huge impact, more than what the people think. So I realized its impact. I realized the change that it can bring, the transformation that it can bring in the person, and I was like, I should tap more into it. And if it helps people get better in their physical, mental, emotional, spiritual problems, then why don't I tap into it and realize the power of breath, which, as it's famously said.
True. So what is this mentality about?
Yeah, so Mentality is a company that I created. Right now, it has my service as a core of it. But yeah, it Mentality as a brand has its own life, and it will grow on its own. It can have various things to it. It won't be limited to my service. The main reason I did not go for a personal brand, which is very famous among breathwork coaches and everything, get a personal brand and everything, was the main reason is I didn't want it to limit to just my expertise or uh, my personal expertise as such. I wanted it to have its own journey. So if there's some or the other product line or anything coming up, Mentality should grow in its own independent. It should not be limited to my beliefs, my way of growing, and my personal growth. It should have its own growth. So that's the company that I've created. There are lots and lots of exciting things coming up in Mentality. So yeah, stay tuned, and I hope it goes well.
True. So do you train only individuals or do you train as a professionals or
Yeah, so I
corporates
have
as well?
different, yeah, so I get it. I have different ways of operating. One is a sector where I have patients with issues such as asthma, breathlessness, other respiratory issues, stress, anxiety, hypertension, and everything. The other part is an athletic training. Athletic training is basically for athletes. It's slightly advanced. In medical domain, in basically patient domain, I basically have to focus on treating their issues. Their issues is my primary focus. If they get better at their issues, they can manage the issue better, or in some mild cases, they can even reverse the symptoms and everything, reverse the problem, then it is a big win for me. In athletic segment, I'm more focused on improving their endurance, improving their recovery, improving their overall performance. Then there is individual one-on-one training to people who are just interested in exploring the benefits that breath provides in various physical, mental, emotional, spiritual aspects. And the other is corporate training, which I do. That's available for various corporates and corporate employees, corporate institutions, and so on.
So how are these, a corporate training different from an individual training?
So in individual training, I'll give you an amazing example of a party kind of thing. So when we are at a party, or when we're just having a get together, the lesser number of people, or if it's just two of us meeting, we can know each other more deeper and
Yeah.
better. But if there's a big group, there are lots of activities and fun things that we can do. Okay, so if you take about gymming or any personal training, the more personal training it is, even in cricket there's a concept called personal training. So when a person does a personal training, the coach gets deep into his technique, his or her
Technique,
technique,
yeah.
and then improves it. Whereas team training, it's more of a team oriented thing, and there are a lot of activities that can be done. So in corporate sessions, there are a lot of activities and there are a lot of things which we can incorporate. Whereas in individuals, there is a lot of customization. There is
Oh.
focus on what you as an individual need to improve. So that's the difference. Both enjoyable in its own sense, but yeah, they both have their own pros.
So how is the role of HR in the corporate section? How important is the role of HR in developing certain breathing patterns for the
Yeah.
employees?
So basically, I have a corporate wellness program, and that corporate wellness program I also have different trainers of different expertise, and we all come together in order to help the corporate. So it's either a one-off session, a yearly package, or something like that. So that is discussed with the HR, and what we are coming up with in terms of our service is there are offsites in corporates. Okay, we want to include wellness retreat as a part of an offsite. So because normally offsites are more of a fun activity. What
Yeah.
if we can improve conscious uh, techniques which improve a person's physical and mental health, and they feel refreshed, re-energized after those 3 days? It'll be an amazing initiative. So we also have an option of conducting ice baths in
Okay.
offsite retreats, grounding, and various physical activities, somatic releases, different types of sound healing, breathwork. There are lots of options for a corporate. So when it comes to your question, HR, so first I have to speak with the HR as to what the corporate wants from us.
Okay.
So once that is sorted, once the HR is gives me clarity on what that they want, we customize a plan according to that particular organization, and then make our services, customize the services in order to deliver that particular corporate. So HR's role is very important because they are the source of communicator in the corporate. They are the corporate's voice. So we have to communicate with them because every corporate has different ways to operate. So different number of employees. So we have to, HR tells us what their need is.
Oh. So big companies like L&T, Group M, they have a regular section of meditation or sound healing sessions. How often do you think this company should engage in a breathing pattern exercise like that?
First of all, I'd like to address that it's a great initiative that corporates are taking part in these things. So credit to all the corporates that are taking and the ones who are looking forward to taking, because looking at this from an employee wellness perspective is an amazing thing. But where your question is how often it should be, the more the better is the obvious answer, because the stress, the amount of stress, work stress, is increasing. It should be directly correlated with the amount of stress that the corporate has. The stress management side of it or the employee well-being side of it should be in a direct proportion to that, right? But more than how often should they inculcate this, I want to address an issue which I faced in corporates, that whenever I take corporate sessions or something like that, there are lots and lots and lots of employees missing out because of the work pressure. Lots of employees,
Yeah, true.
especially who work in a high stress environment. They miss out on, so basically, I take breathing or stress management session. They miss out on the stress management sessions because the work stress is more. So first of all is when these kind of sessions happen,
Yeah.
there should be a space where all the people are free to attend that sessions. So that is number one. Number two is, one is how often I come and take it, and one is how do you inculcate it in your daily work life. So basically, if I give a session, they're just practicing for an hour. But if they can inculcate the things that I do in their daily routine, basically I come there and I take a breathing session, and 2 hours later they go for sutta breaks. So it just
It's
beats the purpose of it, right? So my thing is that how do you inculcate different sessions? Various people come and take sessions. How can you inculcate different things in your corporate routine? And few things which I have found very helpful for corporates are, one is taking breathing breaks. So you can take 30-second breathing breaks and just take 5 deep breaths, and the product, you feel differently. Okay, so that is one thing. The other thing is, because you are in a corporate setting, there are artificial lights, there are smaller screens. Okay, so your body is continuously in a sympathetic state, which is stress response. Okay, a fight and flight state. So just getting out, taking fresh air, and expanding your vision. Okay, looking at the sky, looking at the distant objects, massively helps an employee to just refresh and re-energize. So that is an amazing thing. I even heard recently Google has a thing between the companies like Google and all big companies have that breaks where they give an option of NSDR, which is non-sleep deep rest protocol, which is Yog Nidra in the ancient yoga practice. They also conduct those kind of things during their time. So to answer your question, how often, instead of how often, it should be how do corporates take away from these sessions? What do corporate take away from this session and include in their daily routine so that they're practicing this throughout the year? So instead of just me coming for 1 hour, an employee is practicing 250, 300 hours a year.
Oh, that is great. Like,
Yeah.
you know. And is there a breathing pattern that you want every individual to focus on? So,
Yeah. So basically, we have a set. So our noses are meant to breathe, mouths are meant to eat.
yeah.
Okay. So basically, when you cannot eat something, that's where the doctors and everything put a pipe through the nose. So this is an emergency thing to eat.
Okay.
Same mouth is an emergency thing to breathe. Mouths are not meant to breathe. The whole body's mechanism is designed in a way where we breathe through our nose. Okay.
Yeah.
So first thing is nasal breathing. So people ask me, is nasal breathing important? I say it's not important. It's how it should be. It's
Yeah.
a prerequisite. Okay. So one is prerequisite. The other thing is the breathing should be light. It shouldn't be too heavy. Okay. It should be slow. The pace of breathing should not be fast. If you've seen a person getting stressed, they will be
Yeah.
heavy and fast breathing. So it should not be fast. It should be deep. Okay. It should not be from the upper chest region. It should not have any irregularities. It should have a constant flow and no jerks. Because when you jerk, your heartbeat increases. Your heart gets a shock. So this jerking should not happen. So ideally a breathing pattern would look something like nasal, light, without noise, inaudible, slow, deep. This should be the graph, slow and subtle, without having lot of jerks in between. Yeah? So this is what we aim for. This is what I train people for.
Oh. So, what is that, people have found the change, they have come to you as a testimony and say that, hi, Laura, we
Yeah,
have,
yeah, yeah.
we have got this change. What is the major changes that you have seen?
One major, like there are various issues that I've addressed. One major change is in breathlessness. Those things have drastically changed. People with asthma have managed their symptoms better. The severity of the asthma attacks has decreased. The frequency has decreased. Then there are lots of people with stress anxiety, okay, who have drastically reduced stress anxiety. The occurrence of panic attacks have decreased drastically. And I take care of the physiological part. I'm not a psychologist, I'm not a therapist, okay.
Oh.
I take care of the physiological part, which is your resting heart rate. There are two sides of it. You can get a panic attack because your body is freaked out or your mind is freaked out. Either can happen. So the physiology, the bodily things is what I control through the breath and the other physiological techniques. The other very important thing is the sinus issues get better if they incorporate good breathing habits, and even issues like snoring, they're taken care of.
So, this is as per, NIAID, the National Institute of Allergy and Infectious Disease. They say an estimate of 134 million Indians suffer from sinus.
Yeah,
So,
that's a lot.
can this be solved or reduced at least?
Yeah, so some things are genetic, okay.
Okay, yeah.
Some things are based on your natural anatomy, okay. So those things definitely they can be managed better, and in many cases they can be solved. So obviously genetic is one thing, but there is a lot of scope of improvement for the people with sinus, for the people with various other respiratory issues. There is a huge scope of improvement because they are not taught to train the way they breathe.
Yeah.
They are not taught in school we taught the way to eat. Don't chew food loudly. Has anyone told us don't breathe loudly? No.
No.
We've told to drink this much of water, this much of, how many breaths a minute should we take?
No.
There is no education in that. So because lack of awareness and lack of education and because of those things, they have created a habit which has led to these issues. And to change that, breathing is the one thing they can definitely address. So 100% the issues can get better. There is a lot of scope of improvement, and I've worked with people whose issues have literally got better by just doing simple things.
So, I've always seen, people with sinus, they may be in the most jolliest mood, but when there's a sinus kind of that, that comes triggers to them, they become a very restlessness. They don't know what should they do. They just sleep, they just put their head down and just be there in that moment. So, should there be, or is there certain breathing patterns that, you recommend to them?
Yeah. So I'll just say, generally, there is a great saying in our space that you realize the importance of breath when it's difficult to breathe.
Yeah, true.
And in everything, a sick man, when you get sick, when you get fever, the only thing you want is to get healthy. You don't want any outside food. You just want to get healthy. Same way, when breathing gets difficult, that's when we realize the importance of breathing. So that's why people get so freaked out when they get sinus issues and everything. That's because they understand how valuable a simple breath can be. So yeah, definitely it can be trained. It can be inculcated in their daily routine. There are some amazing techniques which people with sinusitis can do. One of it being a practice which is called Jal Neti. So what you do is, there is a Neti pot that comes. It's available anywhere on Amazon, offline also everywhere. You put a salted lukewarm water in it, okay, normal temperature, just a bit lukewarm. You put it to one nostril and it comes out through the other nostril. There's a technique to it which you have to learn from a yoga trainer or a professional. So that's one technique which clears the whole nostril and your nose is open. The other thing is just snorting some salted lukewarm water in each of the nostrils and clearing the tissue. So basically, people with sinus have an issue of blowing their nose. That damages their airways because you're blowing a lot of wind, so our pipes are delicate. So there is inflammation, and that creates more mucus, and that makes the sinus worse. So there's a whole loop of thing. So that's another thing. Third very good technique is the nose unblocking exercise, which we do is, you just have to breathe in, take a normal breath in, out, and after the exhale, you just pinch your nose and move your head up and down. And when you feel the urge to breathe, you take a gentle breath in through your nose. So, and again, go normal. Do this for 6 to 7 times. Your nose will be constantly unblocked.
Oh, this is such a very nice technique, very simple techniques to practice even in a corporate environment.
Anywhere.
Yeah.
Anywhere, anytime, fully accessible. It's with you 24 hours.
So, how is a sinus versus a normal headache different, and what is the breathing pattern for both of them like?
So a normal headache is generally associated with the brain, blood vessels and the nerves. So that's a different problem altogether. And the sinus headache, so basically sinuses are located here.
Oh.
This is the region of the sinus. So most probably, if you have sinusitis and if you get any headaches on this part, if this part is paining excessively, that's probably a sinus headache, okay? And the normal headaches are, you can feel it on the different parts of the brain. So for normal headaches, it has been seen that deep breathing helps a lot. So what is deep breathing? First of all, take a deep breath. Okay? So this was a big breath. This was not a deep breath. 99% of people, if they're told to take a deep breath, they'll go. What does deep mean? What does deep mean? When I'm in a swimming pool, what will deep mean? What is the deepest end? An end which is which has the most distance from the surface area, which is the most beneath the surface area.
Yes.
So a deep breath should be, if this is surface area, deep breath should go into the deepest part of the respiratory system.
Oh.
So when you took a deep breath, chest and shoulder expanded the most.
Yeah.
Okay, because this part expanded the most, the respiratory system, lungs are here, the rib cage is here, the diaphragm is here, the air predominantly went here.
Oh.
More part of air went on the upper part of the chest, and the lungs are shorter on the upper part and bigger on the other part. And also the diaphragm's movement in inhale should be like this. While you breathe here, it goes like this, which is called the paradoxial breathing.
Oh.
It goes opposite to what its normal thing is, its normal flow is. So a deep breath would look something like this. So your whole
Yeah,
diaphragm,
the core, yeah.
this part, even from the back, if you look at the back, it will expand from the back too. So it will be like a balloon expands from all the
Yeah.
sides. So it will expand from all the sides, it will push the belly out, the belly will expand as a result of your rib cage expanding. The most important part is your rib cage expanding and pushing the diaphragm down. So if you take those deep breaths for like 5 to 7 minutes, you can get a lot of relief from traditional headaches. Okay. The other important thing is you can do a bit of power breathing to shoot up oxygen, and after the end of inhale, 10 or 15th inhale, and you hold the breath and just squeeze this part and imagine the energy going up here, and then after 10 to 15 seconds you relax. You'll feel a slight lightheadedness. So the heavy head, when you feel heavy headedness, it'll go down. So different things works for different people. Either you can do 5 to 7 minutes of the deep breathing that I showed, or the power breathing that I showed. Whatever works for you, you can apply it.
Oh.
And for the sinus headaches, as I told you, Jal Neti, nose unblocking
Yeah.
exercise, those things would definitely work. Other thing which works is taking very small and gentle breaths. So small in the sense, light and gentle breaths. So that creates a very ease in your respiratory tracts, your your airways specifically, and that even improves the carbon dioxide. So basically, when a person with sinus will mouth breathe and hyperventilate,
No.
that creates an off balance of oxygen and carbon dioxide in their body, and because of that, they're not able to oxygenate properly. That gives their brain a signal to even breathe heavily, and they breathe heavily. So this is a loop. It makes the issue worse. So they can just take gentle breaths, and if they do this, their nose will get unblocked, and then gentle breaths to recover. So gentle breathing in sinusitis, in sinus headaches, would work better, and power breathing or deep breathing in a normal headache would work better.
This is like so good information.
Yeah.
I'm going to tell all my friends,
Yeah,
to
yeah,
actually practice, who have sinus,
yeah.
to practice this kind of Jal
Yeah.
Niti and
Instead of
everything.
telling, you can just send a link of this podcast.